You know that feeling, right? Waking up in the morning, taking that very first step out of bed, and boom, you're greeted by that sharp, grinding ache in your knees. If you're dealing with knee osteoarthritis, I definitely don't need to tell you how it affects literally every part of your day. It limits your movement, drains your energy, and honestly, it is incredibly frustrating. But what if the conventional approach of just popping pills and masking the pain isn't the whole story? Today, in this explainer, we're diving into a highly structured, medically grounded therapeutic protocol. And this isn't just about hiding the discomfort. It's designed to genuinely rebuild your joint health from the inside out. So, welcome to our comprehensive guide on holistic protocols for knee osteoarthritis recovery. The insights in today's explainer are pulled straight from the fascinating research of Professor Dr. Ahmet Setian, a highly respected professor of medical genetics. Now, his approach is a real game changer because it's completely holistic. We aren't just staring at the knee in a vacuum. We're looking at the body as one big interconnected system. Dr. Setian's protocol targets the actual root causes of cartilage degradation and gives us a very clear step-by-step roadmap to heal those tissues. Okay, here's a quick look at our roadmap. We're going to cover 5 holistic pillars today: the medical foundation, topical treatment, a rather strict diet protocol, lifestyle and supplements, and finally, the biological path to regeneration. Let's jump right in. Pillar 1, the medical foundation and diagnosis. Listen, before you even think about trying a single home remedy, changing your diet, or buying a cabinet full of supplements, you have to establish a baseline. You need to know exactly what is going on inside your body. Dr. Setian is super firm on this prerequisite. You absolutely must get complete general medical testing done first. Why? Well, because joint pain isn't always just simple wear and tear. Sometimes things like chronic immune system disorders are secretly pulling the strings and driving that joint inflammation. If you've got an underlying autoimmune issue, all the topical oils in the world aren't going to fix that root problem. You need a clear medical diagnosis to make sure some other systemic disease isn't just masking itself as knee pain, so get the tests done first. Moving on to Pillar 2, topical treatment and pain relief. Let's be practical for a second. We're going to talk a lot about long-term tissue repair today, but you really can't focus on a long-term goal if you're in constant debilitating pain right now. We have to soothe the joint first. Check out the incredible synergy of these ingredients. Dr. Setian's protocol calls for a very specific blend of natural oils: olive oil, sesame oil, mustard oil, camphor oil, black seed oil, and peppermint oil. Fun fact here, camphor has actually been used for centuries as a natural local anesthetic because it literally cools your nerve endings. So you mix these together and massage it into the knee. But here is the secret sauce. You don't just rub it in and go about your day. You absolutely must wrap the knee in a warm wool bandage. The wool traps the heat, opens up the blood vessels around the joint, and lets the anti-inflammatory power of the camphor and peppermint, along with the deep nourishment of the black seed and olive oils, penetrate all the way down. Now, if you can't get your hands on all of those oils, don't worry. The source provides a fantastic, super potent alternative. You just take 3 nutmegs, grind them up into a fine powder, and mix that right into some sesame oil and clove oil. Clove oil is pretty legendary for its natural numbing properties, while the nutmeg brings this deep, warming sensation. Just mix it up, massage it into the knees twice a day, and again, this is key, wrap the joint immediately in warm wool. It's a highly targeted, comforting relief mechanism you can easily whip up at home. And of course, alongside the topical oils, mechanical support is totally vital. You'll want to incorporate physical therapies, specifically strengthening and stretching the muscles around the knee, which you can easily find routines for online. Whenever the knee is under load, pop on a supportive knee brace. Use hot and cold compresses to manage any swelling, and hey, if you can, work with a professional physical therapist. All of these physical interventions essentially build a stable, supportive environment so the joint can finally rest. All right, Pillar 3, diet. What's allowed and what is strictly forbidden? So external support is really only half the battle. Now we need to talk about your internal fuel. Quick note, if you are overweight, shedding some pounds is non-negotiable here to take that mechanical pressure off the joint. But beyond just weight, Dr. Setian's protocol demands a massive, and I mean strict, dietary shift. This slide brilliantly illustrates the binary choice you have to make for one full month. For 30 straight days, you are looking at a total ban on all starches, sugars, milk, white cheese, fried foods, and delivery meals. 0. Those foods are huge inflammatory triggers. They basically keep your body stuck in a state of high alert and totally block tissue healing. Instead, you're swapping the junk for the builders. You need to absolutely flood your system with the exact raw materials your cartilage needs to repair itself. We're talking pharmacy-grade collagen, nutrient-dense bone broth, and trotters.
You are quite literally eating the building blocks of healthy joints. To supercharge this internal rebuilding process, the protocol introduces a very specific, incredibly nutrient-dense seed mixture. We're talking about combining cress seeds, flax seeds, and chia seeds. Guys, these seeds are absolute nutritional powerhouses. They are completely packed with essential fatty acids, unique mucilaginous fibers that naturally help lubricate the body, and vital minerals that your joints are practically begging for right now. Adding this to your daily routine is surprisingly simple, but you have to do it exactly right. Here are Dr. Sattine's exact instructions. Step 1. Take 1 spoon of this seed mixture and stir it into a glass of water or a bowl of yogurt. Step 2. This is the important part. You must let it sit for 2 hours. Do not skip this. That soaking period is crucial because it activates the seeds and releases all those beneficial gel-like fibers. Step 3. Give it a good stir and drink it down. You're going to do this twice a day, once in the morning and once in the evening. Think of it as your daily ritual for internal joint lubrication. Let's look at Pillar 4, lifestyle and nutritional supplements.
We've covered the topical relief and the dietary fuel. But honestly, what good is the perfect fuel if the engine itself is completely stressed out? Healing just doesn't happen when your body is in a state of panic or exhaustion. According to the source, you have to actively curate a healing environment. That means deliberately doing breathing exercises to calm your nervous system down. It means actually getting outside for some safe sun exposure. It means prioritizing early restorative sleep because, that's when your body actually does the heavy lifting of repair work. And perhaps most importantly, it means actively avoiding stress and anxiety. Stress pumps out cortisol, and chronic cortisol drives widespread inflammation straight to your joints. So relaxation isn't just a nice to have. It is an active, essential part of this medical protocol.
Now, even if your diet is flawless, a lot of modern food just lacks sufficient mineral density. So let's look at how to build a complete nutritional safety net. Dr. Sattine's protocol outlines specific daily pharmacy supplements you'll need to bridge the gap. You're looking at vitamin D3 and vitamin E, alongside crucial minerals like magnesium and zinc, which basically facilitate hundreds of repair pathways in your body. And on top of that, there is a strict requirement for omega-3. You absolutely must take 1 capsule of high-quality fish oil or omega-3 from the pharmacy every single day. Consider that your non-negotiable daily defense against joint inflammation.
And finally, Pillar 5, patience, your path to regeneration. So after all the warming oils, the massive diet overhaul, and the lifestyle shifts, when do you actually get your new knees? Well, the crucial point here is this massive number, 6. Guys, this is not a weekend detox. This is absolutely not a 14-day miracle cure. 6 is the absolute minimum number of months you must strictly commit to this entire protocol. Why 6 months? Well, because we can't cheat the laws of human biology. Cartilage and joint tissues just don't have a robust blood supply like your muscles do. They heal at a remarkably slow, almost glacial pace. 6 months is literally the biological time required for those specific tissues to shed all the damaged cells, soak up the new nutrients you're providing, rebuild that cellular matrix, and genuinely return to a normal, functioning state. If you throw in the towel at month 2 because you aren't out running marathons yet, you are short-circuiting the biological process right when it's finally getting started. You have to manage your expectations. To really drive this home, let's look at a direct quote from Professor Dr. Ahmed Setnian himself. He states, "Patience is required for at least 6 months to give tissues the chance to regenerate and return to normal." The authority here is super clear. You are giving your body a fighting chance. You are providing the right tools, the time, and the environment. Your only job now is to provide the patience. And that leaves us with one final, incredibly important question. Are you ready to commit the next 6 months to rebuilding your knees from the inside out? You have the knowledge now. You've got the blueprint for the medical prerequisites, the topical pain relief, the strict dietary builders, the lifestyle shifts, and the exact supplements required. The protocol is crystal clear, but the discipline? That is entirely up to you. I really hope this explainer has empowered you to take control of your joint health starting today. Trust me, your future self walking around pain-free 6 months from now will absolutely thank you for it.